seated, comfortable, relaxed, ready for an exciting afternoon. You're all very welcome to Oak House, and this was going to be the replacement really for County Hall, and we were all going to locate ourselves up here at some stage. And it's a mighty fine building, so when you're wandering around it, it's a state-of-the-art place, and I really like it. One of the reasons we're here is that the Rufford Suite, instead of the chamber at County Hall, had very poor acoustics. And at the end of the last meeting, half of the people came up to me and said, "You've been talking for 2 hours, Doddy, and I never heard a word of what you said." And I thought that could be good or bad, but we decided that we needed an acoustic system fit for a health and wellbeing board, and I think you'll agree that this is a lovelier surroundings, etc. Beautiful views out the window if you get bored, and you're all very welcome here. This is the Health and Wellbeing Board of the 24th of September, and item number 1 is to move the minutes of the last meeting held on the 25th of June. These are for noting only, unless you've got a point of accuracy, and not for commenting upon. So I'm going to just go through the pages of the minutes from page 1, 2, 3, 4, 5, 6, 7, and 8, and 9, and move that the minutes be approved as an accurate reflection of the events of that occasion. All in agreement? Excellent. Let me pass you over those minutes. Fantastic. And I'm going to ask James Lavender, Democratic Services Officer, do we have any apologies for absence?
We have received apologies from Councillor Sue Saddington for other reasons and is substituted today by Councillor Mike Introna. We have also received apologies from Natalie Bacon-Napier of the Nottinghamshire Police and Crime Commissioner's Office, who is represented as a sub today by Dominic Underwood. And we have also received apologies from Sarah Collis of Health Watch. Thank you, Chair.
Just to ask, does anybody here present have any declarations of interest, pecuniary or non-pecuniary, to declare if you find throughout the afternoon that something actually occurs to you that you would like to bring to our attention? Feel free to do so. Okay, I don't know declarations. And that brings us on to item number 4, which is the membership of the board. And it's one of those things that, I mean, I've been here since 2012, since the origins of health and wellbeing, back in the days that Andrew Lansley introduced his Health and Social Care Act and moved public health into County Hall. Over that period of time, there have been many changes, and I think we've had to be dynamic to recognise the partners that we needed around the table in order to implement the things that we wanted to implement. Thrown in on top of that, we've got the magnificent 10-year plan. I don't know how many of you have read through the 10-year plan, but I'm happy to pass it round if anybody gets the inclination to do so throughout the afternoon. And not only that, we have the inclusive growth strategy, an even bigger document from the East Midlands Combined Counties Authority, and therefore our direction and where we're going to be going over the next number of months and years is going to be largely aligned to those type of strategies, and that's why we have to continuously adapt. Although we are adapting, I see scarce mention in either document of either health and wellbeing or public health, although their success is based on neighbourhoods wherein health, public health, health and wellbeing will be the bedrock. have asked on numerous occasions now at the East Midlands Combined Counties Authority to establish a committee based on the 4 health and wellbeing boards of Nottinghamshire, Nottingham City, Derbyshire and Derby City, and I will persist in that recognition until I get success. But for today, we're going to concentrate on the membership of the board and the things that we can control. We're going to look at approving the addition to the membership of a senior representative from the Fire and Rescue Service. We are actually going to have a representative from the East Midlands Combined Counties Authority. Put your hand up wherever you are. There we are. There we are. Public enemy number one. There we are. There, executive for place for Nottinghamshire County Council, and they're the additions. For today, we've got new additions of our own. We've replaced Daniel Saban with no less than an NHS intensive care consultant, Kelvin Wright, and Kelvin is sat in the far corner over there. We've also replaced, if they are even possible to replace, Colin Pettigrew and Melanie Williams, two titans since I've been here in 2012, but we've done our best with Anne Coyle. Put your hand up, Anne, wherever you are. Oh, they are over there, Anne. And we've also got our interim adult social care and health Guy. Where are you, Guy? There we go, for adult social care and public health. With that, I'm going to pass over, having noted the recommendations on page 16 of our report that we make these additions. I'm going to pass over for further elaboration to Viv Robbins, the Director of Public Health. Thank you, Viv.
Thank you, Chair. Nice to see you all today and our new members to the board. So as you'll see detailed in the report, we have a statutory responsibility to have a Health and Wellbeing Board, which was through the Health and Social Care Act in 2012 and amending the Health and Care Act in 2023. And there are specific posts that we have to have from a statutory basis, and those are outlined in paragraph 3. But there is flexibility within the boards to think around what the board's direction is and how do we ensure that we've got the right membership to really drive that leadership around having that strategic approach around improving health and wellbeing. So as Councillor Dolly has mentioned, some of the additions that we're proposing today are following on from the Local Government Association review, which many of you will have been involved in, really thinking around what's our purpose, what's our unique selling point as a board, and how can we really enhance what we're trying to achieve in terms of health and wellbeing, improving the health and wellbeing of our residents and our people. We do acknowledge that there are some other gaps that we might want to consider. Particularly thinking around some of our providers across the patch, but we know that there's lots of changes going on with the 10-year plan, as you've articulated, Chair. So what we're going to do is keep a close eye on that, and then we can bring in recommendations around future amendments moving forward. But as the Chair has already mentioned, we've got a number of colleagues that we're really pleased to welcome today and join to the board if the board is in approval of that. And I will ask those colleagues to just do a couple of minutes in terms of just describing who they are and what they can bring in terms of how they can really support us in driving that agenda around improving health and wellbeing and reducing health inequalities. And I would like to just pass on the apologies from Derek Higton. Unfortunately, he couldn't come with us today. He's the Executive Director for Place, and he's really there in terms of thinking around how can we bring in more of that building blocks of good health and wellbeing that we've talked about quite a lot in the board, really thinking about his role in terms of place shaping around Nottinghamshire, and particularly thinking around some of the responsibilities and support that he provides in his broader department around spatial planning, transport, environment, economic development, and again, some of those strong links with our MECC colleagues. But if I may, I wouldn't mind handing over to Damien West, who is Assistant Chief Fire Officer of Service Delivery in Nottinghamshire Fire and Rescue Service. To just do a couple of minutes in terms of Damien, in terms of what you can bring to the board, and then we'll come over to you, Damien.
Thank you very much, Viv. Thank you, Chair. Yes, so as Viv has introduced me, my name is Damien West. I'm one of 2 Assistant Chief Fire Officers for Nottinghamshire Fire and Rescue Service, and my responsibility is over our service delivery element, so that's response, prevention and protection. As it says in the paper, we've been long-standing members of the Nottingham City Health and Wellbeing Board, and that has been for as long as I know, and I've been here for 12 years in Nottinghamshire. We're also members of Safe Nottinghamshire Board and the Nottingham Community Safety Partnership. The fire service across England, particularly in Nottinghamshire, has a proud history of our prevention successes and engagement with local communities. Every year we visit 20,000 homes of the most vulnerable people. We have a multi-agency, multi-referral pathway which we conduct in those premises. And what I would say is that we have very strong links with a number of both your organisations, but also across all communities in Nottinghamshire. We have a really strong delivery function in terms of that. I think where we do lack, particularly within the county, is around that strategic engagement and making sure that we align our priorities. When you look at the health and wellbeing strategy, there's a huge amount of synergy between that and our community risk management plan. And I think as an organisation going forward, we need to be better aligned in terms of making sure that we maximise the use of our resources. We have a strong public trust. As I say, we have a large resource in communities and the ability to make sure that we are working towards the same agenda. So we have a particular focus around early years intervention with our youth cadet programmes. We have a particular engagement with the communities around older people and those vulnerable to death or serious injury by road, water or fire incidents. But we are a proud member of a number of boards, and we would really feel that we can add some benefit and hopefully work in synergy at a strategic level with yourselves here as well. Thank you.
Thanks ever so much, Damien. Really appreciate that. So if I may, I'm going to hand over to Jenny French, who is Interim Head of Reform and Inclusion from East Midlands Combined County Authority. So over to you, Jenny.
Hi, thank you, Viv. Thank you, Board. Just to really sort of say, it's really good to be here. So I work for the East Midlands Combined County Authority. Mayor Clare sort of sends her regards to everybody, but you know what we do know from MECC is they have a real focus on health. Mayor Clare herself really wants to drive that health agenda forward. We do have certain powers and duties through our devolution sort of powers that were given to us. But it's more about how do we actually work together across the region for driving up that sort of the health of the nation, the health of that region. We know there's some severe areas of inequalities that we really need to be able to change. Some of the work that MECC has done recently hopefully will drive some of that sort of inclusive growth that drives that prevention, that drives the health and wellbeing of the population. So just sort of thank you for being here and hopefully we can contribute. Just to note, Viv, I think it is in your paper, it may not be me in the future, and the representative of MECC may change depending on how MECC sorts itself out in terms of where the health sort of responsibilities sit. But until they do that, it will be me coming to the meeting. So thank you very much.
Thank you, Jenny, and yeah, just great that you can join us today. But I think those are the key messages, Chair, that I wanted to cover. And then if we can just move to the recommendations, if that's all right.
Yes, move to the recommendations. Thanks very much indeed. And they fit in very well with Damien and making every contact count, but the sheer volume of contacts that are there and that are out there. And it's lovely to see Claire Ward out and about on a 150-mile walk around Derbyshire and Nottinghamshire. And I think it's one that we're all going to sort of feel that we want and have an ambition to do at some stage because it fits in so well with everybody's agenda. But we're going to let her do it first. Thanks very much indeed. So we're going to move on to item number, after moving the recommendations, which are on page 16, which are exactly as said. And can we have a seconder for the recommendations?
Is there any questions? Sorry.
A question this early in the afternoon. Go ahead, Guy.
Practical question. The statutory officers that are part of the Health and Wellbeing Board have a responsibility to do certain things within the Health and Wellbeing Board, like the pharmaceutical needs analysis, etc. I'm very welcoming of people additionally coming to join the board, but actually, is there a distinction between the signing off of the things that are statutory responsibility of the officers that have to be on the board?
Yeah, by all means, yeah.
So thanks for raising that, Guy, and I think it's a really important point. So I think we try and do as much as we can in terms of signing off specific documents as a board, so that we make sure that we are getting that collective ownership across Nottinghamshire for that. But where there are specific documents where timings don't align or things like that, then quite often we have some sort of delegation. So things around Better Care Fund, you'll see later on we have specific delegation would be to yourself. And Anna will correct me in terms of who those delegations are later on. And things like the pharmaceutical needs assessment, that's been delegated to myself to sign up on behalf of the board, and then it will be coming to the next Health and Wellbeing board. So we do have that that already covered if we need to.
Thank you.
Any further questions? John Wilmot, Councillor Wilmot.
Thank you very much. I obviously welcome the new incumbents to the Wellbeing board. It's absolutely essential we get as many organisations that are meeting the people and getting information out to them, but also they're able to signpost, to the different organisations. When I'm pleased about the fire service. I mean, they're going into homes and they will see whether someone needs help, and they will obviously signpost that person to the right team and so forth, because a lot of vulnerable people just don't know where to go to for any help. And so I just welcome any organisation that goes and meets the people out there to be able to signpost, as I say, the necessary information for help.
Yeah, thank you, Councillor Wilmot. As mentioned, making every contact count is the key, and making those people on the front line sort of able to be confident to make that contact count as well. It just is the whole ethos of what we're trying to achieve. Thank you. Any further questions? Right, so I move the recommendations on page 16 that we approve the addition of the senior representative from Fire and Rescue, senior representative from the East Midlands Combined Counties Authority, and the executive director of Place, Derek, who is unable to be here today. All those in favour? Thank you. And we move on now to items 5, and there's always a connection between items 5 and 6 and 7 as we try and put together the health and wellbeing joint strategy, and this is ambition number 3, which is helping everybody to access the right support to improve their health. And we're going to ask the Health and Wellbeing Board to note the update in Q1, to receive a presentation, which is Appendix 2, and to consider opportunities highlighted in paragraphs 13 to 17, and to endorse the Nottinghamshire Smoking Alliance, etc. So I'm going to move over to Lindsay Winter-Wilson. Lindsay.
Thanks, Chair. Yeah, hi everybody. So Lizzie Winter-Wilson, Public Health Commission Manager at Nottinghamshire County Council. So just a brief introduction from me. This is the next iteration of the quarterly Joint Health and Wellbeing Strategy reporting. As we're now into the 2025-26 financial year, last year's annual delivery plan has been updated with partners to reflect activities and anticipated outputs for this year. And the highlight report that you'll see in your pack covers progress against activities across the Joint Health and Wellbeing Strategy ambitions in Q1, with a deep dive on ambition 3. The covering report provides some background on the reporting process and timeline for future updates as well. And then, as Councillor Doddy has already outlined, highlights where there are opportunities for action for board members' attention. As these all fall within sort of ambition 3 within this version of the report, these will be picked up through the discussion within the deep dive presentation, which we're aiming to be the intended main focus of discussion today. So on that basis, I'll hand over to Grace Brough and also our Place-Based Partnership colleagues to take us through the deep dive. Thank you.
Sorry, thanks, Lizzie. Can I check, are you sharing the slides? Are we talking to the slides today? Okay, thank you. Hi everyone, I'll just introduce myself. I'm Grace Bruff. I'm a consultant in public health at Nottinghamshire County Council, and I'll be presenting the deep dive on Ambition 3 today. And as Councillor Doddy said, this ambition is around everyone accessing the right support to improve their health. So within this presentation, I'm going to highlight some of our key achievements since we last came with an update on Ambition 3, which was in May 2024. I'm going to highlight any challenges and mitigations that we've had in the delivery of Ambition 3, and I'm also going to outline what our plans for delivery are over the next 12 months. And then I'll present the asks of the board at the end. And we'll also be bringing in our place-based partnership colleagues to talk about some of their successes as well. Thank you. So if I just highlight some of our key achievements, and just to say, we're going to talk about tobacco control, mental health, healthy weight, making every contact count. I feel like I've got one there. So if I just highlight some key achievements around mental health. So this year we have successfully launched our All Age Not Alone website, which is really the first port of call for the public in terms of seeking support around mental health. So that's been a real success. We've also published our Adult Mental Health GSNA, and we've launched our self-harm and suicide prevention strategy and charter. We've also had an expert by experience group established, which is aiming to embed the voice of local people in our system-wide work on mental health. When we're looking at successes around healthy weight, we've had a 41% increase in adults in Nottinghamshire achieving significant weight loss in our Your Health Not service, and that equates to 1,400 adults. We've also rolled out a new universal child healthy weight offer, engaging with over 1,000 children and families on healthy weight. Next slide, please. When we look at what we've done around smoking and tobacco control, we've launched our Smoke-Free Homes project, working with our housing staff, training housing staff to really help support our residents in social housing to make their homes smoke-free. And we've also launched Smoke-Free Sidelines to help our local grassroots community football groups have smoke-free environments there as well. We've also developed a new delivery plan under our Nottingham and Nottinghamshire Tobacco Alliance, and that's to support our progress towards the aim of a smoke-free Nottinghamshire by 2035. Around alcohol harm, we have trained over 100 people in alcohol intervention and brief advice, and we've also worked with our primary care networks to present training on alcohol and signposting to our GP colleagues across Nottinghamshire. If we can move on to MECC, please. When we look at our Making Every Contact Count agenda, we really pushed this agenda along, and we've now got a multi-level training offer, and that includes new bespoke e-learning available across Nottinghamshire, and we've got a short MECC introduction session as well, and that e-learning is going to be launched in October 2025. We also run Train the Trainer courses, and we've developed bespoke resources as well around MECC. So lots of good achievements, as you can see, across the last year. Next slide, please. Oh, I'll hand over to Andrea, if we've got Andrea with us, to talk about key achievements in Bassett Law.
Thank you. Yes, this focuses on one of our successes in Q1 this year, which is the Move More campaign, which has been running for 7 years and is a real success locally around demonstrating integration and good partnership work. As you can see, it's a place-wide approach and aims to support people of all ages and all abilities. Some of the key achievements that you can see noted here are nearly 7,500 people engaged in the 2025 campaign. This is reviewed weekly and in our weekly partnership collaborative meetings with all providers, including PCNs, DPTH, EMAS, NCC, and so on. And there's real energy within Bassett Law for May, which kickstarts us for the rest of the summer. It led to 120 health checks being completed in community settings, which on this occasion identified 18 patients with high blood pressure who were signposted back to their GPs. We also had over 100 community events focused around this campaign, just getting people to move more, involving multiple partners from right across all three sectors, actually. And we've noted here National Trust, the Council, Citizens Advice, the Food Bank, Talking Therapies, LGBT+ service. the mental health services, youth services, Active Knots, my own organisation, BCVS, and Youth Health Knots, all focusing on healthy weight management and smoking cessation, as well as moving more generally. In addition to that, our local National Trust partner at Clumber Park issued over 300 passes to enable people, particularly in Core 20 areas, to access our local beautiful green space. And we've seen a lot of wider impact as well on their family and friends through that access. I'll just add, I know I've only got 2 minutes, but I'll just add a wider additional impact in that the recognition of both the strength of partnership working, the success of this campaign, and our own organisation itself has got bigger and bigger in terms of the steps that we contribute. So we pitched in 4 million steps in this month towards, which as a small organisation is pretty good and really did energise the whole staff team. It's also brought us into a priority place for active partnerships and Sport England, and a bid was submitted in September for £1.3 million, which will be called Move More Bassett Law. And it's building on all of this great partnership working, including the investing in communities work that's been happening over the last 3 years. So we'll find out about that next month and hopefully build on the success going forward. Thank you.
Thanks, Andrea. Is it Tillan we've got next, or is it to Helen? Is it Tillan? Okay, yeah, just to say, sorry, Tillan was going to present this, but I'm afraid he's not able to be with us today. So the detail is in that slide pack, but we'll move on now to South Notts and Helen to present on that. Thank you.
Thank you, everyone. I'm Helen Smith. I'm Programme Director of South Nottinghamshire Place-Based Partnership. So just presenting one particular piece of work that's been happening in South Notts linked to prevention and access, which is very much around ambition 3 of the health and wellbeing strategy. So what we know is that premature cardiovascular disease is a major cause of premature death. And so what we did is we ran 6 Healthy Hearts events in Hucknall. And we did this within community venues, so not in a health venue. We used the leisure centre, we used other community halls, and worked with all sorts of colleagues who deliver various services in Hucknall, like described by Andrea, Your Health Knots. We had the local GP services, we had the district council, everyone active, and talking therapists as well. To really work with people to identify if they had any particular cardiovascular risk factors that they weren't aware of. What was brilliant was using the GP practices to invite people to the events. The first one was completely oversubscribed. We had over 450 people queuing down Nottingham Road, so there was definitely demand for this kind of activity. But I think the trust that people had was from receiving a message from their GP to attend an activity like this was really quite powerful. And what we found were a number of people had abnormal results, so that could have been on the day from their body mass index and other things, or it could be through the blood test that they received and had the results afterwards. There were a number of follow-on activities, and the benefit of having colleagues in the room where people were starting those conversations around their cardiovascular risk factors, being able to walk across and actually talk to our Your Health Knots colleagues about stopping smoking, or actually think now probably is the time for me to start losing weight and have a go on the different equipment provided by the leisure provider. So it really activated people in that moment. And like I say, there's been 6 events that have had similar impact. I think what's nice is having some really personal stories that have come out from these events. And there is a quote there that you'll see at the bottom. So a lady who had no awareness of any particular health concerns through attending the event was diagnosed with heart failure and is now being managed really actively, and is really grateful for the service. And we've got a number of those particular examples. And pleased to say that a Healthy Heart event happened in Arnold last Wednesday, and again had a similar uptake for the blood tests and results. So again, that offer of coming to the community rather than expecting people to come to their practice and access all the different offers that are there in that moment to support that behaviour change. Thank you.
Thanks, Helen. And I'll take us through some of the challenges on delivering this ambition. And just to say, I'm going to pick out, say, one challenge from each of the areas because we've got the detail in the pack. But just to say around healthy weight, one of our challenges is that we actually find we've got inconsistent referrals and low engagement with our maternity healthy weight sessions. We are mitigating this though through a programme of CPD for midwives and maternity staff to really help empower them to have conversations about healthy weight with women who are pregnant and then make referrals to these sessions. So we're trying to tackle that. In regards of mental health, we do have a need to identify sustainable funding to continue with our All Age Not Alone website and the programme of associated activities promoting positive mental health. Regarding alcohol treatment, sorry, next slide please, thank you. Regarding alcohol treatment, we do have challenges with primary care identification of alcohol treatment need and then referral on to support for those people who do have alcohol treatment need. But we are working with our ICB colleagues collectively, local authority and ICB together to share good practice around what works. And as mentioned before, this year we've already started doing some training sessions with our primary care networks in that protected learning time for GPs. Regarding the tobacco control agenda, we have some challenges with engaging our communities in reporting illegal tobacco. We find that's a really sticky and tough issue. And one of the things we're finding difficult is we're putting smoking cessation support in place in some of our communities where smoking is a real issue, but actually that illegal tobacco is really undermining our efforts around that, and getting communities to engage there is really difficult. Another challenge is that the sustainability of the MECC offer. So I've described all of that good progress that we've made, but public health resource around developing this is due to end in October 2025. And so our wider partners across the system are going to be asked to self-serve around MECC. And so that kind of partnership then needs to be shared, and the kind of responsibility around that. And so there is a question mark around that sustainability because it won't have that dedicated resource from public health as of the end of October. Next slide, please. You can see some of our outcomes around this ambition here on this slide. So if I just point to a couple of the outcomes that we've got, we can see that we've got 69% of our adults are physically active. That's had a slight uptick, which is a positive thing. But unfortunately, we've got 67% of adults who are overweight or obese. And that is as you can see, that the red arrow, so that's a negative. It's worse than England at the moment. So I've just picked a couple out there for you, but you've got the detail in the pack. If I can move on to the next slide, please. So just to talk about some of our plans for the year ahead. So my contacts aren't working as well as I'd like, so I'm going to look at this one. So plans for the year ahead are that we want to maintain the All Age Not Alone website to support good mental wellbeing, and we also want to incorporate parental and infant mental health into that and promote Not Alone to parents and carers as well. We want to undertake a joint strategic needs assessment to support our system-wide approaches to healthy weight. So those JSNAs would be around good nutrition, healthy weight and moving more. Around alcohol reduction, we want to raise awareness of the needs of people who use alcohol and improve signposting and referral to appropriate support, as I've mentioned previously. And we also would like to limit the increase in the density of alcohol outlets in the most deprived areas. Next slide, please. Regarding the smoking and tobacco agenda, we really want to implement actions within our Nottingham and Nottinghamshire Smoking and Tobacco Alliance delivery plan over the next 3 years. And what you'll see, one of our actions is that we ask the board to endorse that delivery plan. And regarding MECC, we're going to launch that new e-learning, and that's going to be shared with our partners once it's completed in October 2025. And so there will be an ask of partners in the Health and Wellbeing Board to really encourage staff to engage with that offer as well. So if I just go on to the next slide to detail the asks of the board. So I've mentioned some of these already, but our asks of the board are to support the development of the proposed healthy weight and good nutrition and the moving more JSNA, and consider how your organisations can support implementation of the recommendations once those JSNAs are developed. Around mental health, we ask that you continue to promote Not Alone as the main place for people of all ages to access trusted mental health advice and information. Regarding alcohol reduction, we'd like to ensure that drug and alcohol services are embedded within integrated neighbourhood teams as these develop over the next year. Around tobacco control, we ask that you endorse the new delivery plan for the Nottingham and Nottinghamshire Smoking and Tobacco Alliance. And we also ask that you encourage your organisations to consider adopting the East Midlands position statement on vaping. And that's so that we have a consistent approach to vaping when we think of tobacco and smoking cessation. We want a consistent approach to vaping across all our organisations. And regarding MECC, we'd like you to consider how your organisation can support that rollout of the MECC training and support frontline staff across the partnerships to have healthy conversations. And that's it from me. Thank you.
Thank you very much indeed, Grace. The 10-year plan, moving from disease to prevention, it's sort of epitomised by what you've gone and put up there, and the type of thing that we want to see supersized over health and wellbeing boards, over strategic authorities and over the country. There's no doubt alcohol, smoking, obesity and mental health are the top 4 biggest killers and causers of morbidity and mortality, and have been since eternity. Tackling them remains just as important. I saw something whereby if you reduced smoking and got us to a smoke-free status, which is less than 5% of the population smoking, and that exists in Rushcliffe, where it's about 4.9%, but it's still up at 11 or 12% in Mansfield. If you reduced all of them to smoke-free status, the difference in life expectancy of Rushcliffe to Mansfield, which is currently 8 years, would be reduced to 4 years. So by simply intervening in smoking, you would have the life expectancy, health inequality that exists between those two areas. That's how significant smoking is, and killing 1 in every 2 people who smoke. We, in the 10-year plan for Nottinghamshire, have a particular interest in actually reducing smoking in pregnancy, and in particular, again, if we look at smoking on average at something like 11%, women who are pregnant in Mansfield, it's about 13.1%. So not only are they smoking, but they're smoking more than in the normal community level of smoking. And that's where you have the greatest improvement. We have the greatest health inequalities. Of course, our mental health not alone is award winning. And has won awards, and it needs to be continually promoted. And obesity is probably the single greatest reason why life expectancy in the modern world has actually stalled for the first time in 100 years. We're now sort of stuck perhaps in a downward trajectory. So I think the locality presentations are typifying the neighbourhoods that we want to establish, but rather than in a funding void, I'm hoping the 10-year plan ploughs extraordinary amounts of money into prevention. Less than 1% of the entire budget for the NHS goes into prevention, and yet we can see from what you've put up there that this is where the future of prevention lies in tackling these areas. So I think it was a fantastic presentation. I thank all of you for that, and I'm going to open the floor for questions. Councillor Jackson.
Thank you, Chair. There was one point that stood out for me really when you were speaking about alcohol. I can't remember who it was now, about reducing the density of retail outlets. Now I sit on planning committee and I know how difficult it is to turn these sorts of things down. So how are we going to go about getting legislation to support that ambition? Because I think at the moment planning law won't help with that. So have we got a strategy for dealing with that?
So I think you're absolutely right there, Councillor Jackson, in terms of how we create our communities is really important, and that comes back to what things are on the doorstep, what access to services people have got, and how do we create communities that thrive. Now, obviously, there's different planning legislation at different layers of local government and national government. Certainly within the 10-year plan, there's conversations around what work can be done nationally, but obviously nothing is agreed on that at the moment. But I also think that there are more opportunities to think around how we are working with our district and borough colleagues to support them in that decision making. And I'd have to get the exact detail, but I'm pretty sure that the team have already done some work around helping to make some of those decisions and understand what the legislation lies. So I can't remember the exact detail of that on me, but if it's helpful, I can circulate the link to the piece of work that's been done, because I'm absolutely sure that the team have done some work around that we can circulate afterwards, if that's okay.
Thank you. That's really helpful. I just want to add one comment. Before I became a councillor, I'm aware that the previous council turned down an application for a fast food restaurant on the basis of health, and then that was overturned. So it really is a really important point that we need to make sure we get that right. So thank you for that. Thank you.
And nationally recognised the importance of a minimum unit alcohol pricing, which has been shown to be very successful in Scotland. Councillor Polk.
Yeah, thank you, Chair. I thought the presentation was really good. I was certainly impressed with the way we've gone out to communities to, check people's hearts in the car parks rather than waiting for them to come to the garage when they've got an issue, to the doctor when they've got an issue. One thing I was interested in, I know it's part of the government's health strategy, using vapes as an aid to quit, and it's part of our 10-year plan. But in actual fact, vaping now is becoming quite a serious concern with young people. I think the dynamic about us advertising it as being, in inverted commas, a good thing, when in actual fact, in itself, it's a bad thing. It might be better for those that are sort of transmitting from cigarettes to vapes. It's better for them. But I think we also have to be really conscious of the fact that it's becoming very socially accepted by young people, part of social media as well, and that companies produce vapes which are clearly aimed at young people. So part of our 10-year strategy moving forward, I think you talked about having an East Midlands position on vaping. I hope that we'll take these things into consideration.
Yes, it's constantly being challenged regards to vaping, and yet still the public health approach would be it's an aid to quitting smoking. It's not an offer independent of smokers, and certainly is not recommended for children and not recommended for people who've never smoked. But obviously that is the challenge. There are recognised side effects such as EVALI, which is vape, acute lung injuries, etc. We recognise the challenges of those things, and government has banned single-use vapes, which again is a good move. But we still know it's 99% safer than smoking, which kills 1 in every 2 people, and is still one of the leading causes of cancer mortality in the UK. Viv, is there any other thing from a public health point of view that you would like to? Oh, Grace.
Thanks, Councillor Doddy. Councillor, if I can just come back to your points there. Just to say around the East Midlands position statement on vaping, we're really clear that if you smoke, don't smoke, or if you smoke, vape. If you don't smoke, don't vape. It's really clear that it's a harm reduction pathway. And so we do lots of work with young people because, as you say, there is a concern there around young people and vaping. And so we have lots of things that we do. We have something called the Intent Programme, which is a licence that we pay for all of our schools to access, where they can get information on smoking cessation, but also we've now incorporated information for schools to talk to young people about vaping. So there's loads of school resources that we do. We've also, you talked about social norms. And we do social norms work with our schools. So we actually put up posters about how many people in that school don't vape to try to denormalise the idea that all young people vape. So I acknowledge your points there, and just to say we are trying to do work around that. Thank you.
Thank you, Grace. Certainly acknowledge it, Councillor Punk. Professor King.
Thank you very much, Chair. Just a couple of questions. I thought the presentations were excellent, and just really trying to think, how do we build on particularly that community work that was mentioned, and thinking about how we develop that in terms of funding and support for those organisations. Often there's lots of feast and famine, and I just think, particularly if work has been built up into particular communities, how is that maintained? And secondly, as seen here, I mean, the Not So Alone website, I also think is excellent, really well done. From what I read of this, there is sort of some concerns around the funding situation for that, and actually I would feel as though, is that not something that should be promoted more widely and built upon, and how is it going to be kept up to date and maintained as well? Because it seems to me, when I've looked at it, a really excellent resource as well, and probably proportionally actually quite a good investment.
Yes, but like everything, short-term funding, and we're hoping the 10-year plan will actually be the answer, moving money from the NHS to treat disease into the prevention of disease, which we all know is the only way to actually reduce the long-term costs of the NHS. And if those people who are at the workshop this afternoon, this is going to be the topic of conversation, how we make the neighbourhoods work. Grace, did you want to come back on that, or who wanted to come back on that?
Yeah, if I may, thank you. So just to say that we are doing an options paper at the moment with our partners, looking at how we can secure future funding for Not Alone. So acknowledging that it is a really great resource, and it's great that it's now all age as well. So, you know, I'm really pleased that you think it is a good resource. But yeah, unfortunately, we haven't come to that conclusion yet. So we are working an options appraisal up. So I think, you know, it depends what comes out of that, and support from our partners around the room as well, in regards of if we all support that as a resource, can we all jointly fund that together? Thank you.
Thank you. I'm going to ask Councillor John Wilmot.
Thank you, Chairman. I also think the presentation was excellent. It's a lot of work going on. We have to remember, it says in the report that you dealt with over 7,000 people in 2025, but you have to remember there's over 800,000 in Nottinghamshire, so there's still plenty of work to be done. Obviously, I see a lot of problems in my area. There's still a serious problem with obesity and mental health, including many youngsters with mental health problems. They tell me in schools that there's still a serious problem. And tobacco and illegal substance misuse, that's another issue that needs to be continually tackled. Obesity, yeah, you know, we've still got obesity because people are still eating the cheaper food alternatives in supermarkets, etc. And supermarkets and other eating establishments don't seem to be bothered about it, as long as they're taking people's money. You know, I don't know whether we need to get in there and say to them, you know, we need help. The population needs help to be much healthier, because at the end of the day, what happens is that they get a little older, and then they start have to go to hospital appointments, which are overrun a situation. So I just hope that people take that into consideration. There are healthy alternatives, but as I say, they're not presented on supermarket shelves and things like that, which much to my disagreement. Exercise is very important, but we've got to make sure that people on low incomes, elderly, are able to go to exercise classes, and they're not outpriced in the development of these situations. That's absolutely so exercise opportunities must be more available and publicised as well. As far as mental health is concerned, help must be made easier to obtain. It's essential that where the help is, it must be publicised well, to make sure that people have got the opportunity. As I say, I think now that we need to get in each of the towns some premises that all these things can be brought in front of people, so that they get the opportunity. In Hucknall, we've got a 2020 vision place who actually invite all the organisations, whoever you are, to come in and let the people know about what's available to them. And I think every town should have that opportunity, and it should be a nice big sign up. If you need help, it's here. Make sure that it is an opportunity. And as I say, availability and help and information has got to be advertised better so that people get the opportunity, because not everybody's on got a computer. Unfortunately, as I say many times, 40% of the population haven't got one, and they need help as much as, in fact, most of them need help more than those people that's got all that information. So thanks very much for all the information that's been given. Great help, but there's still gigantic problems that need addressing.
I don't think anybody could argue with any of that, Councillor Wilmot. I think it was Colombia that put a 30 to 40% tax on sugar products and reduced consumption by 10%. So sometimes the bravery of governments are necessary to reduce high sugar consumption, etc. Councillor Walters.
Yeah, thank you, Chair. Just tying on a little to what John just said. Mental health support, okay, this is nuts and bolts. If as a councillor I have my doubts about a resident, or about a resident's mental health, would this not alone be my first point of call to signpost me to whatever I can do to help? Who would be the first port of call? That is a thing that I really would like to know.
I think that could depend on the severity of the circumstances.
If I think the person's suicidal.
Grace, did you want to answer that question?
Thank you.
Go, or Lucy, take your pick.
Hello, that's a really interesting question. Thank you. Yes, Not Alone would be a brilliant place to signpost people to. It's there for people of all ages to find out about all different sorts of mental health support. And for suicide prevention, there is a suicide prevention webpage on there as well. And we are looking at some training for our Nottinghamshire County Council councillors from the Samaritans on how to talk about suicide and suicidality, and it might be something we could explore for district and borough councillors as well. Just checking if would be okay with that.
And of course, we did champion mental health first aiders in the workplace. Somebody who would pick up on mood changes and depression in the workplace. So, did you want to come back, Councillor?
Just quickly, okay. If Not Alone would be presumably the first port of call, is that a website? Is it a phone number? Is it through Notts County Council? I'm totally
yes, through Notts County Council, but it is a website that you just go on like any other website. You just put in Notts Alone, and as far as I'm aware, last time I was on, it came up and gave you a fantastic array of opportunities. Go ahead, Lucy.
If it would be helpful, I can circulate some information with the minutes as they come out around Not Alone, and also about relevant training that might be helpful.
Well, for me, it definitely would be. There's another weaponry in the arsenal. Yeah, great.
Brilliant, no problem.
Thank you very much.
Thank you, Councillor Walters. I've got three others asking questions before we move on from this particular area. I've got Damien West, Helen Smith and Kelvin Wright, and I'm going to get the three questions asked and then answer them at the end of that. Damien West.
Thank you, Chair. I'll keep it brief. I think it's the perfect follow-on item from voting us onto the committee, so thank you for that, because I think there's so much more work we can do in terms of that community engagement. There's great work that's happening already. It won't be a surprise to members that we're quite an advocate for the smoking and cessation, particularly, and I think that's a good demonstration of at a tactical level, we're really well engaged. I think at a strategic level, there's still gaps. So something that we push with every single person that we visit who vast majority of their smoke is around safe smoking and part of a pathway to cessation. I think at a delivery level, we're doing that well. Strategically, we've got two separate plans in terms of that. So really welcome the report. Some fantastic achievements, I think, but a really good demonstration of how we could work more closely strategically to make sure that our organisations are all aligned. But thank you.
Thank you. Well, the next Making Every Contact Count will be an in again for you there, Damien. Moving on to Helen. Where are you, Helen? There.
Yes, it was just in response to Professor King's question around the funding of the community health events. So part of the work we've done in Hucknall is we're working with Trent University to evaluate in terms of costs and outcomes. So hopefully that will give us some really good evidence to support actually it's cost effective. The staff really enjoyed it. People that attended really enjoyed it. And actually we found conditions in people that we've been able to prevent and use some sort of funding calculations by finding people early. What have we saved in terms of that funding? Thanks.
Councillor Wright.
Thank you. Just a few points. I really wanted to get into the conversation more for the work stream development going forward, really, than expecting direct answers today. Regarding the mental health, I'm sure the online app is good, but I've got to tell you that 25 years of A&E practice tells me that when people are in crisis, direct them towards an app may not be the most appropriate option. And I think we have to acknowledge that the mental health services are in absolute crisis. They are on their knees, both in children's sector and in adult sector. And I'm afraid that is where a lot of the work stream needs to be directed to. So I don't wish to rain on the parade, and I don't mean any disrespect, but an app and a website is not the answer to mental health crises across Nottinghamshire. It's as simple as that, I'm afraid. When people are suicidal, wading through a web page is not the answer. On the second point, on the injectable products around weight loss, I'd like to throw into the mix that obviously there is both medical weight loss, there is unfortunately these days social weight loss, and there are diabetics who need Mounjaro. And I just think the work stream around injectable products and weight loss need to consider all of those three options. I've personally seen 2 Mounjaro attributable deaths, so it's not as safe as everyone always thinks. So I think that's an important element to bring into that work stream, please. A smoke-free Nottinghamshire. I've never smoked, never wanted to smoke. Don't like it, but I do understand there is an element of choice in this. And I think in elements of social deprivation and areas of social deprivation, your audience will be somewhat less receptive to Big Brother just telling them what to do and what not to do. I often see families in the hospital in the absolute pit of their emotion, and going out for a fag helps them greatly. And I always have to try and stand in the way when the security guard comes up and says this is no smoking site, when these people are weeping and wailing and having bad news broken to them. So I do think there needs to be some consideration around your goal of a smoke-free Nottinghamshire. I do wholeheartedly agree with the thoughts from Councillor, I beg your pardon, Polk-Pack, I beg your pardon over there, I can't, poor eyesight, sorry. Polk, I beg your pardon, thank you. Vaping is a big social issue and needs to be addressed. And once again, I've seen a multi-organ related death from someone from excessive vaping. So again, not as safe as prescribed on the tin. And this needs to be considered as well. So I just put in a medical wholehearted support for those comments. So thank you.
Thanks very much indeed. I suppose the vast majority of people who visit websites, particularly the Not Alone section for parents and carers and people who are looking at how to deal with family members who've got those type of problems, etc., directing people to help for conditions that are not suicidal as such, but could prevent going down that pathway, and that's a huge amount of it is around the preventative rather than the immediate acute response to that. It's very interesting that the 10-year plan, for the first time that I've seen, is actually incentivising the path to good living. I think that's what it puts it as, incentivisation. So we may see people in the most poorest communities with the greatest health inequalities being increasingly incentivised to good living. And I think that that's perfectly reasonable, and I look forward to that. I do think the weight loss argument is going to be won by the pharmaceutical companies at some stage. The fact that there isn't enough of it about isn't necessarily the argument. It's just that I think that's where the battle lies. I think that's been fantastic. Oh, I'm going to give you the final word. How's that?
Thank you,
Go ahead,
Doddy.
Grace.
Just to, I guess, kind of add to some of the points that the councillors just made. When we're doing our healthy weight JSNA, we will be looking at injectables as part of that and thinking about what information, advice and support are needed for people who might be prescribed or accessing privately, because obviously the NICE guidance is around NHS prescribing along with tier 2 provision and having that wider support, and there's only a very small amount of people who can get that on the NHS. We're really aware of people accessing that privately and the need to try to do something to help mitigate some of those side effects and unintended consequences that might be happening around that. So we're going to be considering that. And also just to say, a point taken about the website, and I think it's thinking about where we sit in regards of that, the kind of continuum around prevention. And actually this is, as we say, that first port of call for people who are perhaps more acutely on that pathway. There's work going on within our ICB, a pathway, the mental health pathway group that's looking at really the urgent and crisis support elements of that pathway. So just to say where this is placed on that continuum of work that's going on around mental health.
Thank you, Chris.
Thank you.
I'm going to move on now after moving to recommendations, which are on page 22, which I started by outlining around our success at delivering in Q1, our recommendations in Appendix 2, paragraphs 13 to 17, and endorsing Nottinghamshire and Nottingham's Smoking and Tobacco Alliance. I move to recommendations. All those in favour? Thank you. We're going to move on now to an associated article, which is number 6, making every contact count. And this is really to seek the support of organisations and partners for the rollout of MECC training and to highlight the opportunities and challenges in regards to the sustainability of the programme beyond October 2025. I pass over to Paul Miles. Paul, over to you.
Thank you, Chair. Good afternoon, everyone. As Councillor already said, I'm Paul Miles. I'm one of the senior public health and commissioning managers within the Public Health and Communities Division at the County Council. My team and I have been coordinating the development of a new Making Every Contact Count, or MECC, offer for the system over the last 18 months. I'm very grateful for the opportunity to bring a dedicated item on MECC to the meeting today. The paper that you've received in the pack builds upon the Ambition 3 Spotlight report we've just received. Firstly, just running through where we're at, including key achievements and challenges. Secondly, asking for the board's support to roll out MECC training opportunities across the system. And then thirdly, just opens up a discussion on the sustainability of the programme once the initial development period funded through County Council Public Health Reserves ends next month. For any board members that are new to MECC, it's a technique that focuses on the conversations that we have with people in our day-to-day work that support positive behaviour change. Locally, we call these healthy conversations. Staff and volunteers can improve their confidence to have these conversations through training, i.e. by focusing on their own behaviour. And then ultimately what we want is for them to be able to support residents by finding out what is important to them, providing information and advice, helping them to set goals, and then signposting them to relevant prevention services. But it's not just about training. Having a high quality training programme is really key. But embedding MECC is also about developing the right infrastructure, culture, environments across our teams and our organisations and the wider system to deliver on our prevention priorities and ensure the right building blocks are in place to build a healthy Nottinghamshire. Key achievements through this initial phase have been around all of the targeted engagement and co-production with staff, volunteers and residents across the city and county that have helped us build the offer. Secondly, with the alignment with other programmes of work that are focused on prevention, such as building blocks of health, personalised care, and then the emerging neighbourhood working offer. And then thirdly, the development of a new multi-level training offer, resources for staff and organisations, and support for the new community system directory. There's also been a few challenges along the way since we started out. Timescales, in terms of, as we heard in the Spotlight report, there has been some delays in the delivery of some of the products that we're trying to roll out across the system. And there's been some governance issues in terms of there's a very rapidly changing landscape around governance at the moment, and also around representation from some organisations, which remain key issues, hence our keenness to come and present today. We've also been unable to find a single point of access for all things MECC that would have enabled accessibility for all staff and volunteers, and also evaluation. Having a suitable training portal for cross-cutting initiatives like MECC, which has caused us delays in terms of setting up, but it also remains a system gap. Considering these challenges, at the last Integrated Care Partnership meeting in March, there was a renewed call to action on MECC. Organisations were asked to consider how they could support the rollout within their organisations and partnerships, i.e., as Grace mentioned before, more of a self-serve model rather than a coordinated programme with a single point of access as we set out for. The key ask from the paper is for board members to support, remind, reinforce actions to roll out MECC across their organisations and partnerships, specifically from October onwards, when Public Health will no longer be providing support for the programme in the same way. And some of these opportunities for action include, firstly, encouraging our large organisations to embed the new e-learning on their learning management systems and then promoting it to their staff. We need to roll out and cascade longer forms of MECC training that are included in the appendix. These are just for targeted staff, and we've got a cohort of new trainers and champions across the system that should enable this. Both of these actions would then enable the evaluation and monitoring of outcomes. And then lastly, in terms of sustainability, discussion is needed on where MECC is going to sit, i.e. To continue to embed it alongside the building blocks of health. There's a big push within our partners that have been working on MECC to see that it's embedded within neighbourhood health, but also thinking about where any smaller bits of future funding might come from, i.e. to ensure we've got representation across the train the trainer cohort, for instance, going forward. Thank you, Chair.
Thank you very much indeed. You mentioned the ICP there. Of course, the ICS divided into the ICP and the ICB, and the ICP, like the guiding mind, to help the ICB remember what prevention is and put funding into it. And of course, the government wants to close down and end the ICPs, and we've been told that they're about to end, but they're statutory bodies, so it's going to take a law to actually remove them. But we're told that their function is no longer necessary. I would argue that it's never been more necessary. Director, over to you.
Thank you, Chair. So just building on what Paul's done, first of all, thank you to the team and the range of colleagues across Nottinghamshire who are already supporting the Making Every Contact Count or MECC programme. A tremendous amount of work has been put in to really ensure that across Nottinghamshire and Nottingham City, as it's a joint piece of work, that we have got a really strong prevention, early help and building blocks offer. And I suppose just building on what Paul has said, the reason why we're bringing this here today is because this is a call for action for Nottinghamshire. A lot of work has been done in terms of setting up an approach that organisations can take forward within their own organisations and think about how they may want to flex that approach or pull out certain elements of the plethora of work that's gone into MECC to make it work for the particular staff group and people that they're serving. So I really would endorse the paper. I would endorse the MECC approach. We know that strategically it's been highlighted as one of the key areas of work that we wanted to drive through the integrated care strategy. And I think we're at a pivotal point now in terms of really thinking around, as a system, are we keen to take this on and are we going to move this forward? And I know there are colleagues around the table that have really grabbed this with their hands and are running with this, but there are also colleagues that are maybe a little bit unsure around what added value that it's going to bring. But for me, this really is around making sure that all of our frontline staff, regardless of the organisations that we work for, really understand the building blocks of good health and well-being, but also have the tools and capability to make those very short conversations, and we're not asking them to be experts here, to be able to make those connections with the individuals that they're saying, to then signpost them onto those preventative services. So it was just really to add and thank you on to Paul. Thank you, Chair.
I'm going to open that up for questions, but if you're a frontline staff member, it's life enhancing to be able to intervene in people's lives in such a positive nature, and you never know when it's going to be the one that you actually help, the doorbell moment where you actually prevent something very, very serious. This is going to go to a vote, and hopefully that we'll all support it. Guy.
Thank you, Chair. And there's lots of good work in here. I think I just want to make a plea and a reminder, really, that if you look at it from an individual's perspective who might be in receipt of it, I just am conscious that sometimes signposting can mean that people get passed around quite a complex system quite a lot of the time. And actually, the whole point of the cultural change about making every contact count is about enabling people to do some of that work themselves and come back to the person and be able to share that information or whatever it is. So I'm just conscious I don't want this to become a thing that becomes a signposting from one place to another, because actually we already have a lot of that, and actually feedback from people says that doesn't give us what we need, really. So I just think we should be mindful of that signposting element of this.
Damien, you're at the front line with this type of thing. Do you get that type of feedback?
So I think, again, at a practitioner feet across the threshold level, this works really well already. I don't believe we're signed up to this just yet, but the principles of making every contact count are absolutely at the heart of what we do in the community. We have really strong referral pathways which work well in relation to smoking cessation, relating to loneliness, mental health, support in the home, adult and child social care. And I think that works really, really effectively across partners. There is definitely more we can do, and I think having that adopted approach would help. One of the bits of feedback which we do consistently get is around that ask of the person on the front end who's meeting with these vulnerable people, and I think around the breadth of asks, because we also have Prevent Board, which are asking for engagement. We also have other initiatives both within the organisation and other partners. But I think where we can amalgamate that training and make it a simple ask in terms of the questions, that professional curiosity, and that I think, like you said, Chair, trying to improve people's lives. How can you do that? And then I think it is, like Guy says, making sure that we've got effective pathways which we know that work, and that we take that time to check and balance that sometimes as well. But I think we have this working really effectively, and I really endorse and support the paper, because I think if we can improve that even further, that would be great.
Professional curiosity. I really like that. Councillor Jackson.
Thank you, Chair. I suppose I want to just add a little note of caution, and it goes back a bit to what you were saying earlier, Councillor Walters, about the staff that are asking these questions, and I'm hoping the training will cover this, then have to be able to deal with what the response is. So if you say to somebody, how are you feeling today? And they say, well, I feel like killing myself. What does the staff member do? I'm hoping that's covered in the training. But also then, how do we support that staff member that's been in that difficult position? And I'm hoping it's covered in the training. It should be, but I just would like that assurance, because and as you've just said, we're asking a lot of our frontline staff, and we need to make sure we look after them. It might trigger something for them. So can I have that assurance, please? Thank you.
Who would like to answer that? Paul. Yep.
Yeah, thank you for the question. I suppose the answer is a yes and no, because the key principles of the Making Every Contact Count approach focuses on like generic conversation skills, so good listening, asking open discovery questions, etc. But one of the beauties of it is you don't have to be an expert in any particular topic. And as Viv said, it's about those really short, very brief or brief interventions, so short conversations. So it's about being able to support someone to identify something that is important to them that they want to work on, and then understanding that the action that you can, one of the best actions you can take is you might be in a better position to navigate our systems and find them the right services. So it wouldn't necessarily go through exactly what to do in that scenario. It's more of a understanding your role in prevention and highlighting some of the key skills. But the the specific topic areas or supporting people, that's about making sure you understand where the signposting routes are, and then it would kind of go to that wider piece on, in that mental health example, the Not Alone website, knowing how to get people the information about that, for instance, or encouraging them to go to their GP, call 111, that kind of thing. So it's kind of opens up a conversation. But yeah, so yes and no.
I'm going to get the director to follow on from that. Yep.
And I suppose just to add on to what Paul's saying there, the MECC training is around that opening up the conversation, but doing it in a supportive way. But we have to acknowledge there could be situations like that. And I think one of the things that we have built in with the MECC approach is also, and I can't remember what you're calling it, Paul, you will correct me on this, but having a cohort of support, so that people that are working through the MECC approach, one can have that peer-to-peer support, particularly if they're looking at training around that. But there is also flexibility around how organisations want to work. So if you have particular roles where you think there might be particularly concerns around mental health or suicide prevention, that's when some of the work that Lucy's been talking about would be brought into that, because that's what I mean in terms of how you tailor it for the audience that you will be working with. We can never predict every single conversation with every member of our communities, but there will be common themes that come out. And I think that's why I'm really keen for organisations to take this and own this themselves, to think around how they pull on the bits that they would do. So the MECC almost provides a generic framework for them to build on, but then it does provide a platform that, as Damien mentioned, that we can think around how we build on some prevent bits onto that, or we build on some strengthening the bits around mental health and suicide prevention. But we need to get the baseline first. So that's what we're really asking for today, but absolutely acknowledge where you are with that.
So if I could just briefly, I'm partially assured by that, but I do think that there is also a risk, therefore, that staff will not ask those questions because they don't want to have to deal with whatever that response is, and we need to be very mindful of that as well. Thank you.
Thank you, Councillor Jackson. Professor King.
Thank you. And no, it's a really excellent paper, lots of really good ideas in here, though. The only thing I'm wondering about is you talk quite a lot about training and development and support things, and there's a little bit about how you evaluate it. But I'm trying to think, how do you know this is working? It feels like it's a cultural change rather than something that you can measure in other ways. And taking the last councillor's point as well, the people who will be engaging with this will be busy and they'll have lots of other pressures, and if you engage with this might mean other elements of their working practice they have to put aside as well. So I'm trying to understand, and I don't see much in here about almost be able to assess and understand culturally the change that's going to happen, and when you've got competing priorities, how you make sure that this can be taken seriously when perhaps that's not the things people are measured in their day jobs.
Thank you. I'm going to take one last question and then try and answer them both together. I've got Councillor Wheeler.
Thank you, Chair. I've read this report, it's quite interesting, but my question really is around the making every contact count, is around issues, particularly if a person's got past trauma. So I suppose what I'm asking here is, will the element of training include trauma-informed practice? So that, because as a professional myself, I work with young people, and I do know that young people on quite a few occasions end up telling their story multiple times to multiple professionals and end up going round in circles and end up reliving past traumas linked to sexual abuse or domestic violence. So it's really important, if we are going to make every contact matter, that we ensure that people are aware of the issues around trauma and they're not re-traumatising people with issues that may have happened in the past. Thank you.
And of course, Councillor Wheeler, since the origin of Health and Wellbeing Boards in 2012, the prime intervention has been exactly this. We've been talking about this for 23 years, making every contact count. Over to you, Director.
Some really valid points there, and thank you for raising them. In terms of the cultural change, I think that is what we're trying to achieve here, in terms of really thinking around how can we look at an individual as a whole. And now I absolutely acknowledge there will be some situations in professional working life where that's just not suitable, or that's not the right time. And I think what we're just trying to do here is build the tools in the toolbox for staff that are working out in our communities, so that when they do have the right time, and that will be their professional judgment in terms of knowing when they feel that that is the right time to do that. So we're not necessarily expecting that every single person is going to, every time they meet an individual, is going to have a brief intervention, but it will build them in that skill set. And I think as part of that culture, there is something to then think around how we are addressing some of those broader areas that are surrounding the health and well-being of that individual that they may be working on, which may take a little bit more time for another professional at that time. So if they're going to sort out a housing need or some benefits needs, or whether they're going to look at that low-level mental health potentially. But we know that the evidence is there around prevention being better than cure, and we know that the evidence is there around investing a little bit more time in that earlier stage will then reduce the impact on high-cost services across our system at a later date. So I think you're right about the cultural change, and I suppose that's the ambition that we're trying to drive for in Nottinghamshire around that. I'm not saying that's easy by any means of stretch. And then in terms of the trauma-informed practice, I think it's a really important point. And I'll ask Paul to bring in some specifics around trauma-informed and just a quick one on evaluation. But this is where I do think we think around, if we get the baseline right, that's how we can make sure that we do build on this. But we've not got the baseline sorted yet from a prevention point of view. But absolutely taking those points on board. But I don't know if, Paul, if you wanted to add just a very quick reply on any of the other bits.
Yeah, thank you ever so much for the question. Yeah, so just on the trauma-informed bit, the making of a contact count training itself would enable staff, particularly like new starters to our system, to understand better their role in prevention, improve their knowledge around stuff like the building blocks of health, also improve their knowledge around behaviour change and how to have these healthy conversations in practice. When we talk about that, we've also tried to make those linkages across to other agendas that we know are important. So, for instance, within the e-learning module that's been developed, you've got examples of videos that we've produced that specifically focus on domestic violence as a particular issue that we know is important to highlight in Nottinghamshire. So we've tried to build in those links with other important agendas through the training itself. And then also the MECC training will then signpost on to other training offers. So if you are in a role and you know that you are going to support people that have been through some kind of trauma, then there are other modules beyond MECC as a starting point that you would ideally want to push people towards so that they can access the kind of top up on that knowledge and skills that we know that they'll need to build their confidence having conversations.
And indeed, their ambitions may lead them to go to that training themselves. And with that in mind, I'm going to move the recommendation that we're going to vote on is to ensure that our organisations and partnerships roll out MECC training, which is the new e-learning, and identify champions and trainers for MECC from October 2025, supporting frontline staff and volunteers across neighbourhoods and teams to have healthy conversations, contact people, to key services and play an active role in prevention. It's got to be what neighbourhoods are all about. I'm going to ask people to raise their hands if they're in support of it. Going to say that that's unanimous. Thank you very much. And we're going to move on to the item number 7, which is the Families First Partnership Programme and the NUTS approach to that. And the Health and Wellbeing Board is asked to note the progress of the Families First Partnership progress, endorse the whole system transformation and support the multi-agency collaboration. And I'm going to pass over to Amanda.
Yes.
Yeah,
Yes,
Amanda
thank you.
Collinson. Go ahead, Amanda.
Thank you very much. So, as you've said, we're here to update you regarding our approach, Nottinghamshire's approach to the Families First programme. To give it some sort of like context, the programme is national reforms. There's been £500 million worth of funding for this year nationally put into the reform work. In Nottinghamshire, we've had £3.2 million allocated to us. It aims to, there's a real focus on prevention, and it aims to really get children the right help at the right time, avoiding children and families reaching crisis. So the Department of Education have given us some guidance, some sort of like underpinning frameworks that we're working to, but the underpinning legislation underneath all of this, above all of this, is the Children and Wellbeing in Schools Bill. So we're seeking to strengthen multi-agency safeguarding arrangements, integrated family help services, early help and children in need, expert-led multi-agency child protection teams, and enhance support for family networks. So you can see there's a real emphasis on multi-agency, multidisciplinary working. We've had a lot of support through the Department for Education. We have the objectives of the programme and the delivery methods that we are working towards, but also areas where we have local flexibility. So in order to deliver the whole system reform, we must absolutely involve all relevant stakeholders. It's really important around this multi-agency, multidisciplinary aspect to this work. And the other thing that we need to do is understand our communities. So we're undertaking a piece of work in relation to a needs analysis of the county. So we understand actually what our communities, where our communities are, what resources are within our communities, in order that we can understand what we need to do to provide further support if that's necessary. We are really keen to engage children and families and hear about their experiences in terms of services, the service delivery, and hearing from our workforce and what's going well for our workforce, but also what support they need in order to deliver the programme, but understanding the challenges that they have on a day-to-day basis and understanding what it is that we need to do in order to help them to deliver what we need to deliver. I'm really interested in some of the mental health conversations that we've had here today, because I think that that's something that we really need to think about within the programme in terms of our whole family approach. So I've said we're undertaking a local needs assessment, so really understanding what the needs of our communities are, what's being delivered and where, and really again understanding what our workforce are currently delivering, what our approach to practice is, and how we can have a consistent approach across that. Diana's going to talk to us about the actual programme itself, so I'll hand over to Diana.
So, good afternoon. So I'm Diana Bentley and I'm the Principal Child and Family Social Worker for Nottinghamshire County Council and one of the lead officers who's in heading some of the work streams that we've got. So we've currently got 6 main work streams, which I think as I talk through them, you'll see I've got really close links to the 4 ambitions of the health and wellbeing strategy, which is quite good really, because that's why we're here. So the first one is about early help system redesign, which is about family hubs, offering services and supports to children and their families from 0 to 19. So that's universal and targeted services across in community-based, patch-based settings. The second work strand is about the front door redesign, so creating a seamless access point for families. And people will be familiar with the multi-agency, yes, the MASH. The acronym is the MASH, but yes, multi-agency safeguarding hub. But we also want to make sure that all access points, families can access the same services, whichever route you come into, so it's seamless to a family and there isn't that re-referral on to another place. The next work strand is about developing our family help services, so community-based multidisciplinary teams, which will be led by family help lead practitioners, which is a new kind of role that we've sort of been mandated. We've got to create and develop, and these teams will be mixes of social workers and alternative qualified practitioners from different agencies, so that, as Amanda said, we'll have our local needs assessments, so there'll be drug and alcohol support that the community needs. It's the right number of people, hopefully, to provide the services. Hopefully some mental connections with mental health, domestic abuse professionals. So it's not just local authority led. This is definitely about multidisciplinary work. The next work strand is developing our multi-agency child protection teams. And that is developing an expert-led service, which is a multi-agency. So that is about health, education, police, and the local authority coming together with the same expertise to provide families with the support they need at that time of crisis. We've also got a work strand specifically looking at services for adolescents, which is scoping a targeted service for our vulnerable adolescents. And this is a new work strand for us, a new piece of work, bringing together all of the different services, options that we have, which is about edge of care. So that's children who are at risk of going into care, but also children who are able to leave the care system and move back into living with families or within the community. Young people who are at risk of exploitation, youth justice, youth mental health is another one of the kind of hot topics that that service is going to be looking at. And then the final work strand is about the practice models. So co-designing, embedding a practice framework which supports the multi-agency working with shared language, values, understanding, because sometimes, we might work together, but we might have different language and understanding of what things mean. So really going to try and work across the board to have that shared understanding. And it's just interesting, the conversation you've just had, because one of the approaches is about having trauma-informed approaches across the system, working with children and families. But fundamental also to this approach is working with whole families and working with family networks, having family-led decision-making and offering families the options to have family group decisions, decision-making meetings where families can actually support each other rather than professional services being the answer to everything. So the transformation is underpinned, as Amanda said, by up-and-coming legislation in the Children's Wellbeing and Schools Bill, but also our legislative framework, which we currently have, which is the Children's Social Care National Framework and Working Together to Safeguard Children. So it all has to align up with that. So our local needs assessment is going to be really fundamental to how we do design what we do design in the future. We have bottom lines, obviously, of our legislative guidance, but what we then are able to do will be guided by the locals' needs assessment of what different communities need. And one of the kind of questions is what is a community? So we can get data on a very, very small level, on a postcode level, and it's really interesting looking at that. So the transformation will use what we're calling a test, learn and grow approach, which means we don't have to have all of the answers all at once. We don't have the answers, so this is about co-design, co-production with children, families and our workforce, the people who are probably got the best answers because they're doing this day to day. And our colleagues designing small scale approaches to transformation, testing it out. And we've kind of using the phrase, we'll fail fast. So if it's not going to work, we won't carry on with that test. If it is working, we can then at scale and safely build up to be system-wide transformation and avoiding risks of trying to do everything all at once. We're going to do this slowly, I suppose, but at pace. Yes, yes.
Thanks very much indeed. So the last time I heard fail fast and learn, it was the SpaceX rockets being launched by Elon Musk, and it was just blowing up in the middle of nowhere. But that's where he learns most from. A whole system transformation, 0 to 19, it's such a variation of age. The needs of the teenage services and adolescents from a mother with a newborn baby, they're like different worlds, really. One of the big words in the 10-year plan is co-location. How much of this can realistically be co-located in family hubs and things like that?
I think that's what we hope to determine through the needs assessment in terms of what we're, the work that we're doing to understand communities. And as Diana says, what is a community? A community for adults might be something completely different to a community for children. Children tend to be based around a family of schools. So we need to work that out locally to understand what it is communities need. But I think it's really, really, really important that, the focus is on prevention. We need services at a local level in order to make sure that children and families get those services, and that's all of the work that we're undertaking.
Thank you, Chair, and thank you, colleagues, for really interesting reports. Some really exciting stuff here, isn't there? And I think a couple of things for me, really. First of all, we're really keen to get you into the neighbourhood workshop later, because I think it's really important that we think around how we're strengthening that children and young people's voice in the neighbourhood work, and really thinking about how we're aligning some of this. So it'd be great to have your contributions for that. The other thing I just wanted to pick up was really pleased to see some additional work going on around our adolescents. So we talk a lot around Best Start, but we know that there's a lot of work that we want to do more in terms of the adolescents and the preparing for adulthood space. And I'm just really keen to make sure that we link you in with a number of things. So there's a few colleagues here that are on the Safe Nottinghamshire board, and I know that we're having a lot of conversations within that space around the causes of the causes and how do we link that into the community safety agenda. So happy to be the conduit in terms of how we can link you into some of those, but I think I'd be really keen to make sure that we capitalise on that opportunity to really think around how we're supporting our young people who may have particular risk factors that might lead them down slightly different routes. So that was the other one, and I know particularly from my division's point of view, obviously we've had some conversations around smoking cessation tobacco and the intent programme, but keen to link you in there, but also thinking around some of the work we're doing around the suicide prevention. We've had quite a lot of conversations around mental health. We know that young people's mental health is a particular priority that we've seen post-COVID, and there's some specific work, Lucy's going to correct me if I'm wrong, around young people's self-harm and suicide prevention that, again, we'd be really keen to link you in. But really pleased to see this and really keen to make the connections moving forward. So thank you very much.
Anne.
Hello, colleagues. Nice to meet you this afternoon on my third week in Nottinghamshire. Just to say that it's been, really interesting to come in to the partnership and to the organisation to look at the fact that we have just the great conditions in which to make the Families First partnership really fly. Every partnership and council across the country are dealing with exactly this requirement, and I guess it's important to be clear with you all that this is a requirement. It's not really a request. It's a requirement of how we do business. But it's very impressive in terms of our ability to make this really right for families at the very first point of need. So, just to say.
Thank you, Anne. Councillor Introna.
Thank you, Mr. Chairman. Thank you, John. Can I first welcome Guy and also Anne to Nottinghamshire County Council. I've seen evidence over the last few years of the work that we've done and has been done, particularly in areas like family hubs, which have been absolutely a fantastic development and a great resource for people, certainly in my division, and I've seen elsewhere. Children in care services, foster carers, including the work that's been done on recruitment and retention. Excuse me. And the improvements we've seen in SEND provision, including a brand new school and extra places at places like St Joseph's in Retford. It might be easy to look at this from the outside and think, okay, more talk, but maybe less action. But my experience is quite the opposite. I've had the absolute privilege of being the chairman of the Children and Families Select Committee until quite recently, and professionally, I'll say it's been one of the most rewarding experiences I've had. Completely apolitical, supported by good councillors. On occasion, Councillor Wilmot would come in and substitute and support, and certainly people like James, who supported the whole administration of that committee. But the officers, such professional, dedicated officers such as Amanda, and many of her colleagues such as Irene, Jenny, Samantha, Rachel, Peter and Paul, amongst many. And I'm sure that such dedicated people are in other parts of our county, and I certainly look forward to many positive developments in this area guided by such terrific people. Thank you.
Thank you, Mike. I don't think that there's any of us don't share your optimism for the future of family hubs, etc. And indeed was there when we had thousands of Sure Start centres in the past, and everybody recognised the positivity with regards to maternal and child health, etc. A whole system transformation is quite a challenge. I will go to one last speaker, and why shouldn't it be you, Councillor Wilmot?
Thank you very much, Chair. If on this agenda today, if there's one most important, as far as I'm concerned, that's children's welfare. It really is an issue that I've held in my heart over a number of years and tried to help as much as I possibly can. It's very important work. We've had problems all over the country on some of the issues which have been really upsetting. And because anything that involves children, as far as I'm concerned, needs to be fully worked through to make sure that all the problems that there are tackled as the best way they can. This is a situation where all our partners have to work together. It's no good having half of them working and then suddenly people at meetings missing because of whatever the situation. If there's a report coming forward that needs everyone's input, then make sure that everybody gives some sort of report about it to make sure that the help is there for everybody. Can I say it's a must-work system. It's absolutely essential that to whatever work is done, it works. There's never been a system like this so important, and because there are many families out there struggling in life, and they do need general life. They have general life problems which need addressing, and access must be easily, available. They must be able to. The practitioners that are trained need to make sure that they have the necessary expertise that's required, because, as I say, it's such an essential part of the work. But the question is, as I say, the implementation of this project is very, very important. Is there a system for monitoring this, which is essential for all new projects? Thank you.
Thanks indeed, Councillor Wilmot. And ambition one is to give every child the best start in life. And one of our priorities through the 10-year plan for Nottinghamshire is that no child will be left behind. This is a very ambitious programme. We didn't even touch on autism, neurodevelopmental disorders, the challenges of SEND, etc. And there's a day's you could have a day's conference on this. I move the recommendations that we note the progress of the Families First Partnership Programme, endorse the whole system transformation approach and support the multi-agency collaboration and engagement. Move the recommendations. All in favour? Thank you. We move now to item number 8, which is the Joint Strategic Needs Assessment Work Programme. Joint Strategic Needs Assessment are the framework by which we strategically oblige the Council to recognise challenges that exist within the population of Nottinghamshire, and they are dutifully required to address those. They're a fantastic source of information to anybody looking up any district for any problem. 42, I believe, live on Nottinghamshire Insight, and huge bodies of work which can take 6+ months to actually complete. Item number 5 addresses the joint strategic needs assessments that we believe that we're going to carry out in the next period of time, and we've identified 3 areas of dementia, healthy weight and nutrition, and moving more. With regards to that, I hand over once again to Grace to enlighten us. Over to you, Grace.
Thank you, Councillor Doddy. As Councillor Doddy's mentioned, the GSNA is a joint and strategic needs assessment. It's a statutory responsibility that we undertake GSNAs, and so every year we go out to our partners and we go out to the Health and Wellbeing Board to ask what topics are emerging where we think we need an area of focus to understand the needs of our population in Nottinghamshire around that area. And so this year we have gone out to our Health and Wellbeing Board members and to our ICB colleagues, our place-based partnership colleagues, and colleagues within our Nottinghamshire County Council, and also Health Watch. We have assessed those topics that have been suggested against a prioritisation matrix, and that's really to ensure that any resource that we put into developing this GSNA is in an area where we feel that there will be most impact for our population, and we're ensuring that those are both joint and strategic topics that are being put forward. And really, I bring this today just to ask really for the approval of this work programme going forward from the Health and Wellbeing Board. The topics that we propose for the work programme, as Councillor Doddy has said, are dementia, healthy weight and good nutrition, and moving more, which is all around physical activity. Just to say that all of these GSNA topics, where topics already exist, they are quite out of date, and all of these topic areas are relevant to our population needs. With dementia, we anticipate there to be a 50% increase in prevalence over the next 2 decades. We know we've got some really sticky health indicators around obesity and around physical inactivity and healthy weight. So we're really trying to understand the needs around that so that we can start shifting the dial on some of those things. We've done a programme of improvement work around the GSNA, and we're going to be continuing doing that, auditing the recommendations that come out of our GSNAs and looking at how they're implemented. And so the ask is of the board to approve this programme and to note some of the work that we're doing to maximise the GSNA's reach and impact. Thank you, Councillor Doddy.
Thanks very much indeed, Grace. And of course, that they're not to the exclusion of all the existing GSNAs, they're just the current programme of work, etc. I'm going to just open that up if anybody has got anything to ask around the dementia, obesity and moving more GSNAs going forward. Dementia, it's a big subject. It's not a uniform subject. It can be vascular dementia, it can be Alzheimer's, Lewy body dementia, so it can be quite a big area. Andrea.
Thank you. It wasn't one of those topics actually, the food and nutrition, healthy weight and nutrition. GSNA development, and it's good to hear that these will complement, of course, existing up-to-date GSNAs.
Yeah.
So we've done a lot of work across the system and placed partnerships around development of the food GSNA, which has much broader scope than just prevention of obesity in all aspects of health and wellbeing. So just wanted to check and understand that it will add value and sit alongside that rather than replace it.
Chris, that it adds value in other areas rather than simple weight. It could be folic acid in pregnancy. Go ahead.
Yeah, thank you, Andrea. And just to say that we, as you say, we have got that food sustainability GSNA, and we're working with colleagues to kind of dovetail these together. So it's about adding that value and rather than replacing. So just to reassure on that point.
Yes, thank you, Chair. Obviously, being involved with people with dementia, it is a real problem that we all face, and I'm just concerned that it doesn't. The action that people are taking very often are not the right way forward. And there doesn't need to be more training for people that have got serious problem with a relative or whatever with dementia, and I think that needs to be looked at. I really do. But you know, dementia is a serious issue, and there just doesn't seem to be the training that for people who are involved with that situation. And of course, back to the weight problem, again, I've got to say that we have to get in touch with the food industry and sort this problem out better than it's done at the moment. It just seems that everything's just put on the shelves, and it doesn't matter what calories it is or whether it's good for your health or not. There needs to be a programme where the food industries, along with the government and the councils, everybody involved in it, to make sure that we try and tackle obesity, which isn't really being tackled at all at the present time. And, physical activity, again, another issue that I brought up earlier on. It's got to be made available to everybody if they want it. It shouldn't be that you've got to have the necessary resources to be able to keep active and so forth. And that's another issue that needs addressing in the near future. And all these three items are very, very important. We should all get involved in it to make sure that action is taking place. Thank you.
And indeed, we've engineered a world that encourages inactivity. Yeah. And that's one of the great challenges. We discussed obesity at length earlier on, and dementia, as you say, education. We did have the Alzheimer's Society come in and make us all dementia friendly. And we're training for all the councillors in the assembly rooms not long ago. Do you think that's something that you would sort of embrace again? So perhaps we could make a little note of yes, yes.
It's not people. It's hundreds and hundreds. Many of them don't tell you.
Yes. But there's a variety of causes as well as everything else. So there our work stream going forward, and I'm going to recommend that we note the work stream going forward, and we're now going to move on to. So, all those in favour? I should say all those not in favour. There's a lot less work involved in that. We're going to move on to item 9. So we're almost there. And remember, at 3 o'clock, there's custard creams. And coffee and biscuits, so, and tea. So, sorry? No, you can only have one, John. You're only allowed one biscuit, and you have to walk to get it. I'm not bringing it into you. So we got the Better Care Fund. Now, the Better Care Fund's been around for as long as I've been around, and it's a sort of a Section 75 agreement between the NHS and social care that money can move from the NHS into social care, which would not normally be allowed, as spending money outside the NHS is contrary to regulations. It's grown now. I think the last figure I saw was something like £107 million, and this may well be the vehicle, the Better Care Fund, whereby we get the preventative agenda off the ground, where we supersise the Better Care Fund and create a huge flow into neighbourhoods and into local authorities as we move forward. But the person who knows more about that is going to be Anna Oliver. Where are you, Anna? Yeah, there we are. Go ahead, Anna.
Thank you, Chair. So, as Councillor Doddy's just mentioned, the BCF has been around for quite some time. It was first established in 2015. And the idea is it was to pool budgets between the NHS and local authorities. There's a way to reducing those barriers that we face by having those separate funding streams. The idea is that we will work together then to improve outcomes for people, tackle inequalities, enhance our productivity, and also make sure we have value for money across our system. The VCF is a little bit complicated. It is made up of three funds, and as Councillor Doddy mentioned, it is a large sum of money overall of 128 million. So it's a large sum of money that sits within there, but it's all split up slightly differently. So there's some bits clearly badged to hospital discharge, some bits towards our disabled facilities grants, as well as the bigger pool of BCF. We have to submit our quarterly reporting to NHS England, and unfortunately the timescales we're given by NHS England don't always line up nicely with the Health and Wellbeing Board dates. Hence Viv's earlier comment about having a delegated approval process for that. So each quarter we tend to bring a report to the Health and Wellbeing Board asking for retrospective approval. We are monitored on 3 core metrics for our Better Care Fund, those being the numbers of people who are admitted to hospital as an emergency admission, any discharge delays, and our admissions into residential services. We also provide a quarterly update to NHS England on our outputs, so our delivery against each of the lines in the plan and the expenditure against those. The expenditure and output are all exactly on plan. We are where we need to be. We're reporting that everything is as it should be. Of our 3 metrics, only one is slightly off, and it's off by 1%, so it's our delayed discharges. So we're just 1% off there, and we're really confident we can pick that back up locally. So the ask of the board today is just to ratify the submission that was made to NHS England on the 15th of August.
Thanks very much indeed. Statutory obligation to quarterly approve these figures. Sometimes we have to make retrospective decisions, etc., but recognise that. So I'm going to just ask everybody to ratify the complete Better Care Fund Q1 reports. All those in favour? Excellent. I'm going to quickly move on to the work programme and ask people to formally recognise the recommendations on page 106 of your packs. Page 106. And the work programme is Appendix 1 on page 106. And we're currently on September the 24th. Our next workshop is on the 10th of December, which will be Ambition 4. And we'll be also looking at the transformation programme again in December. And again, the Better Care Fund will be there. And we'll have a workshop on better care. And I just draw your attention to that. Any comments on the work programme? Excellent. So I recommend that it be noted and members make any further suggestions for inclusions in the work programme in consultation with the relevant officers and partners. So I'm going to move the recommendations. All those in favour? Thank you. And at 2:03, we're almost on time. 3 o'clock was tea time, and we're at 1:03. Now, before we go for biscuits, there's a person who deserves a biscuit more than anybody. No, it's not you, Councillor. It's not you, Councillor Wilmot. Yes, yes. I would like to thank Lizzie, who goes on maternity leave shortly and has been a rock and a stalwart to the Health and Wellbeing Board over the last number of years and taking a break. When do you go on maternity leave?
2 weeks on Friday.
2 weeks on Friday? Okay. Yes. Yes. I know you'll miss us. Viv, would you like to say a word to thank Lizzie?
Yeah, just really want to thank Lizzie on behalf of the Health and Wellbeing Board. I think everybody's seen the tremendous and sterling job that she's done in terms of making sure that the ship is on track. Has done a tremendous amount of work in terms of steering us and supporting us in terms of the Local Government Association review of the Health and Wellbeing Board, and has really put some rigour into the Health and Wellbeing Board to make sure that we're making sure that we have the most impact we can, but really thinking around how we've done some quite significant changes to the board since Lizzie's been in post, and she's been absolutely instrumental for that. So wish her absolute the best over the next year and our next exciting chapter, but just a thanks from us all.
Thank you, Lizzie. Did you want to say goodbye?
Yeah, just thanks very much, Chair and Viv, for those very kind comments. And yeah, hopefully we'll see you all back in about a year's time.
About a year's time. So at dead on 3, it's time for custard creams and tea and coffee. We're back in here at 3:15 for a transformational workshop. If you thought this bit was exciting, wait till you get to that one.